everyone, it's Lauren again, and I am 2 weeks now being post-op after having an abdominal hysterectomy where everything was removed but my ovaries. And I had a slight injury to the bladder during my hysterectomy where I had to wear a Foley catheter in my bladder for 12 days after my surgery. So now that my Foley catheter has been removed, I have a few things I wanted to pass on that were really helpful to me. I want to preface this video and any other future videos I upload in saying that I am not a medical professional. I'm not a nurse, not even a nurse's aide. My medical terminology is just stuff that I learned in college, and I did work as a nurse's aide for about 10 months, but I have no credentialing or ability to speak on this matter. Any information you need, I would go directly to your doctor. This is just a first-hand account of things that I encountered, things that I learned along the way. So things that kind of crept up on me, and it was a little scary and a little stressful. And again, on the internet here, I don't find a lot of information, and I have no intentions of being a videographer or YouTuber because I'm terrible at it. But I just want this information to be out there. If this would help even one person, making these videos will have been worthwhile. So a few things that I want to pass on, just tips, things to watch for, things to kind of know in advance, and a few ways to just manage having a Foley catheter and how to be comfortable, how to keep it clean, and how to make sure everything is draining fully and everything is as it should be. So day 12, I was able to have my Foley catheter removed. Excuse me. I was able to get that removed. In order for that to happen, my doctor ordered for me to go back to the hospital to have a cystogram, which is it's an x-ray procedure of the bladder, and they needed to make sure that the repaired areas and just my bladder in general, everything was okay and safe for the Foley catheter to be removed. And thankfully, music to my ears, it was. So the radiology tech there, or nurse, I'm not sure, she was so sweet. She said, hey, we're going to do your procedure, but heads up, your doctor's not wanting us to remove the catheter here. They will do that there at their office, so you'll need to contact them. Okay, no problem. So did that, went home. The very next day, not even 24 hours later, my doctor's office did call. They said, yeah, you're good to go. Your doctor has already said we can go ahead and remove that catheter, so just come on in. So they were kind of working me into their already very busy schedule, right? So got that removed, and now that it's been a full 24 hours after I've had that removed, I have a little bit more information to pass on. So we'll get to that, and I'll try to make this quick. So just a few things about having a Foley catheter in place. I was sent home with a small packet of literature of just what to do. Everything kind of went back to contact your doctor, contact your doctor. If this happens, whatever. But I feel like if you're going to be sent home with a catheter in place, there might be another separate little packet of just really specific information and like what to do, what not to do, hygiene tips on how to position yourself when you're sleeping or sleeping or sitting to make sure that the tube and everything is flowing and not pinched. So it would have been helpful, but I was able to draw, luckily, a little tiny bit of information from when I was a nurse's aide for about 10 months, just like Foley care and what to do, what to look for. And so that really doesn't give me any more of an advantage than any other person. So just a few things I had seen before, and because I had emptied Foleys before and cleaned them and cleaned the ports and everything and made sure that was all sanitary. And just the overall idea that when working with your Foley catheter, any of it, the tubing, anything, it needs to be done in a very safe and sanitary manner. Hygiene is the biggest thing here. And that's my first tip on just what to do and how to take care of your Foley at home, is to maintain the best hygiene you can. Especially after surgery, you may not be able to get up. There are like adult cleansing wipes or anything I would say anything unscented. There are even unscented baby wipes. If you can't get up to shower, definitely, I mean, at least 2 to 3 times a day, I would, wash your hands, use hand sanitizer, and use an unscented wipe or something, maybe like the medical grade. I'm sure there are some wipes out there to do what they call Foley care. So you want to clean around the tubing where it is entering your urethra, male or female, and kind of clean and go down the tube away from the body. You always want to go from the body and away. So just removing any, little bit of deposits of, build up. If there's a little bit of crusting going on, that's going to remove that and really keep that area clean. The second thing with that is going to the restroom. So having a bowel movement, of course, you're going to have to do that. So when you do wipe, try to always wipe front to back. And if you can, use baby wipes or flushable wipes to clean the area, again, going from the front to the back. If you can, I recommend hopping into the shower, get a good clean shower, good hot shower. And what I did, because I read you should not use towels, and certainly not reusing towels. This is definitely one time you don't want to be using, your roommate's towel, your boyfriend's towel, anything like that. What I did was I actually just dried off with like a hand towel, and I would only use that on my body. I would just let that area, the genital area, air dry. I did not want to introduce any bacteria to that area. So definitely that helped, just allowing that area to air dry, not introducing any bacteria, because the big thing is trying to avoid a UTI, and I got one anyway. So, but if this helps anyone, certainly. And another thing is allowing the tube to drain fully and adequately. When I had mine attached at the hospital, there was some kind of a securing device on my left thigh, because my Foley was on the left side of the bed. It was facing the door. It was easier for the nurses to get to that way. At home, the side of my bed is on the right, so I secured my Foley, the tubing, to my right thigh, and I allowed the tubing a little bit. It's kind of like a half S. It would make a little curvature from away from my body. It wasn't like tight. That would allow for a little bit of movement. If you shift in your sleep, if you turn over, it's not going to pull, because it is very painful when that happens. So, and again, it's allowing it to be free-flowing and not getting pinched or bent, which would occlude the tubing and not allow your urine to drain away from your bladder. So I did that. And then the thigh securing little device honestly was crucial, because that kept everything in place, and the tube is just laying like right over the thigh. It's going right over my thigh, my right leg, right down. And another thing too is, of course, your Foley catheter, the collection bag, needs to be lower than your body. So not on the ground. You don't want it touching the ground. But if you have a walker, a chair, part of your table, or even on your bed, if you can hang it like they do in the hospital, that is going to allow the tubing to drain adequately. So definitely that thigh strap, make sure if you're at the hospital, if you don't have one, or maybe ask if you could get an extra one, because those were so helpful. So another thing I did was I naturally just sleep on my back anyway, but I found that if I did turn onto my side or turn away the other side, I noticed that it wasn't draining, and I would start getting like a spasm, like pain. And that's because urine was building up in my bladder, and I would look over, sure enough, nothing had drained for like several hours. So if you can, you might try to just sleep on your back. You might even like have a pillow over you, just over your stomach, and kind of hug it. That might keep you from fidgeting and tossing and turning so much. Another thing I ran into is kind of watching milliliters in and milliliters out. So if I drank, like let's say a big tall glass of iced tea or water, and like an hour went by and nothing had passed, the same thing would happen. I would start having this pain. So TMI, I would have a little bit of like tissue and a little bit of like blood clots or something. Like they're small, but like little particles of tissue and stuff. that I was passing, and I would notice after nothing had passed for like 30 minutes or so, I would have like a gush of urine, and you'd see one of those like floating little clumps of tissue or something. And I think that's what was maybe clogging the tube. I really don't know, but I ran into this several times. So, again, if you've just had a meal and you drank a whole glass of juice or water or something, and 30 minutes to an hour go by and nothing is emptying, you might try a few things. So what I did was I would stand up, definitely just like let gravity do its job. And sure enough, like I would just get with my walker, hang my collection bag on the walker, and just stand. If you can, try to stand. That definitely helped. And sure enough, you would almost feel like the pressure build up and then the bladder would empty. So another thing too is if you can ambulate, if you can walk, try to walk. If you're home, try to walk to your kitchen and back, or just, make loops around the couch, whatever it is. That definitely helped, because again, I could feel urine in my bladder, but it wasn't emptying. If anyone knows, in the comment section also, if anyone knows why that is, or if you have other tips and tricks of like what to do when that happens, let us know down below, because honestly, it was really scary. I thought, the whole point of having this catheter in place is so that my bladder isn't expanding and getting full and stretched. It has to heal. So this is impeding the whole process. Now I'm going to have problems. So definitely, that helped. Just standing, taking a quick walk. Another thing, I don't know if anyone else has ever experienced this, but with a catheter in place, but I would go wash my hands. Just for some reason, the sound of running water seems to stimulate the same thing. Have you ever had, where you hear water pouring and you really have to go pee? You're like, it almost hurts. The same thing would happen, but I would notice a whole bunch of urine would pass through the tube at one time. I had to keep my gosh, I kept looking like that was a lot. Like everything I drank the last hour all at once was coming out instead of gradually. Excuse me. So a third thing I would do is I would get a quick, just warm shower. Not a hot shower, but somehow standing in the shower, and I think the water, it does somehow stimulate that to empty. And my bladder, sure enough, right after my shower was emptying. So I don't know if it was those particles and tissue and blood clots. So gross, and I'm so sorry. It was gross for me too. But I think that was maybe clogging something, if it was, within the bladder or in the tube, because that tube is quite thin that's coming out of your urethra. So I really don't know. I think maybe enough pressure had to build up, and sure enough, that would pass, and I would see something floating and thought, God, maybe that's why. But again, there's no literature, there's no information that I was sent home about this, so I had to learn on my own. So those three things: get up if you can, stand, walk, and wash your hands or take a shower. Somehow that stimulates that muscle memory to void and empty the bladder. So another thing too is I would, and I wish I had done this because this information might be available, but definitely ask your doctor or nurse if you have questions. I'm really big on self-advocacy in terms of health, your own health. For so long, I would suffer through certain symptoms and not talk about it because I didn't want to be a bother. I knew the doctor was busy and this and that. But if you can, if you wake up from your hysterectomy and they're telling you, well, we had some injury to your bladder and you're going to be sent home with a Foley catheter, you might let them know, hey, I have some reservations about caring for my Foley catheter myself at home. Do you have any literature I can take home? Some tips or something? I wish I had done that. I didn't think of it. I guess I kind of assumed it would have been provided. It wasn't. They literally brought me discharge papers and I was gone. So again, I should have heeded my own advice and advocate for yourself. Ask those questions because again, you're going home. Your nurses and doctors are not going to be right there. So I was given a number. I'm assuming it's just like the main clinic number for recovery or something, but I did have a phone number somewhere in my paperwork. I don't remember where it is now, but to call if I had questions. So there is that. But again, this was happening at like 2 in the morning. I would have like pain and I'm thinking my bladder hasn't emptied. at all in like 2 hours. What's going on? It's a little scary. You can't just call the doctor's office at that point. So, and they did tell me, by the way, they did tell me just to go to the hospital. If something happened, you know, go to the hospital. But I do live 45 minutes from the hospital where I had my procedure. So it wasn't ideal, and I didn't want to be driving. So all that to say, you know, definitely advocate for yourself. The last tip I wanted to pass on is kind of what to possibly expect after your Foley has been removed. When I knew I was going to have this removed, I went ahead and brought a pair of underwear, and I put just a light pad already on there. I just went ahead and tucked that on there, and wanted to have that ready to go, because I didn't know, like, once they remove the Foley, am I going to have a little bit of like incontinence? Am I going to dribble a little bit? I wasn't told anything. They literally removed it, and they're like, okay, you're good to go. I thought, I had questions. I know they're busy, but ooh, I don't really know. But definitely, if you're going to have your Foley catheter removed, you might want to bring a pair of underwear and a pad. They do make, of course, incontinence pads, but I didn't have those at the time. On that topic, I have had slight dribbling going on. It's been very, very slight. And I notice it's after I empty my bladder, because I was reading the urethra and all those little tiny muscles, you know, they've all been stretched. So for everything to kind of go back to normal, that will take time. It's now been almost 48 hours, and I'm still wearing like light pads and changing those every couple hours. And sometimes I have a little bit of urine that has just passed unbeknownst to me, and several hours go by and it doesn't happen. So I feel like it's on the mend, but it's one of those things you might want to, you know, pick those up, or have someone pick up just some light incontinence pads, just to help with that. So, and I wanted to sleep with just like an extra towel or a blanket under me, because I thought, especially the first night, like, what if I wet the bed? Like, what, you know, I mean, there's so many things you don't know. I've had a catheter in place for almost 2 weeks. What is my body going to do? Will I wake up when I need to go pee, or is it just going to come out? So it didn't, luckily, but I noticed the very first night, that morning, I had a little, you know, yellow spot about a teaspoon or so of urine that must have passed onto that panty liner. So TMI, but this is reality, right? So anyway, I hope those things help. If you have any other tips or tricks you'd like to pass on, things that you have learned, if you have any questions, if I could be of help at all. Again, I'm not a medical professional. I'm just a person on the internet that experienced this and went through it and just wanted to pass this on. But I do appreciate your time. I will hopefully have another video on just a kind of in closing of just what went well and what I wish had gone differently with this total hysterectomy process. So again, thank you so much for watching, and let me know in the comment section down below if you have questions or anything I can help with, and I'll see you on the next video. Bye.